Well, we are back, and Dr. Corenman joins us now. He is with the Stedman Clinic. We're going to talk about back pain and improper and proper ways to lift. And with a lot of people getting back to work, maybe after a couple months off during the off season or doing different types of work, it's really time to think about, how are you lifting things? Or even if you're just moving the Christmas decorations around in the garage, getting ready for the holidays.
It's so true. We see a lot of professional athletes, and most of them don't injure themselves on the field. They're at home lifting up an envelope or pushing a car or something like that.
Yeah.
The injuries from lower backs are so significant for little activities, and so I thought we'd talk today about why lifting is so important and how the mechanism of lifting is relatively simple but injurious if you do it wrong.
Yeah, you always hear about lift with your knees and pull
Right.
the item close to your core.
Right, that's true. But most people don't do that because when we're little kids, we don't think about lifting. Our backs are great and you can lift and push and pull without having any problems. But unfortunately, when we get older, our backs get a little more fragile and you have to learn how to lift differently.
Yeah, and I think a lot of times we're just in a hurry and we're not stopping to think, am I in the right position to, I'll grab something out of my back seat of the car or, go to the dishwasher to lift something up, and I might not be in the right position to do so.
That's exactly true. Most people injure themselves with simple, non-thinking activities. When we're in a rush, if we don't prepare ourselves to lift, that's when we injure ourselves.
Yeah, and you're kind of amazed at how that little slight movement can injure you so badly.
You get a professional baseball player in, and he says, I was just bending over to lift up a pen, and my back went out. And here he is making plays and sliding into second base, things like that. So it's a little crazy to think that little activities can do it, but that's mainly how these things occur.
Okay, and you have some diagrams that'll kind of show what your discs are doing, what's happening during lifting.
Exactly.
Let's take a look at these.
Well, this first diagram is a simple diagram showing a side view of a spine. It's called a motion segment. And if you think about it, there are two vertebrae, and they're separated by the shock absorber, the disc in front. You can see on the right side, that's a normal disc, and the pressure inside is normal. But as we get older, the pressure in the disc drops. And those fibers on the sidewalls, like the sidewalls of a car tire letting the air out, those fibers get a little less tense and have a little more play, which is one of the big problems.
Okay, so decreased space between the vertebrae.
Absolutely. Let's go to the next slide. So this shows you what the disc looks like. Everybody calls the disc a jelly-filled donut, and it really is. The interior jelly's like the air in a car tire, and the outer plies, there are 30 plies, just like plies on a radial tire. And if you look at the picture, I'm sorry, go back.
Go back. There you go.
So if you look at the picture, you'll see the plies run in different directions. And this is important for lifting because you'll see in the bottom right, when you twist, half of the fibers in the disc tighten up and the other half loosen up. So just by the simple act of twisting, you lose 50% of the strength of the disc.
Wow.
And this is the biggest deal of anything in lifting, is that the twist is what's detrimental. People, when they twist and load their spine, are going to injure it.
Okay.
Now, if we don't mind going to the next. This is a picture of, on the left, the normal disc in the resting position. And as you lift, this is what happens to the back of the disc. The back of the disc is under significant tension. So you start to add these factors up. You twist, so you lose 50% of the strength of your disc, and then you bend forward, and you're putting all the stress on the back fibers, and you're developing a situation where you can start to tear the disc. If we can go to the next picture, please. So this is a complex picture, but it's a side view of a person who's bending forward and lifting. And you have to go back to physics in high school to remember all these terms. But in reality, if you look at the load, you remember Archimedes said, if I had a lever long enough, I can move the world?
Yeah.
Well, what he was saying there is that you can develop enough stress by a long enough lever that you can create a lot of force. Well, that's what happens to the back. Is that you look over here and you'll see the back is under significant stress as you lift something.
Okay, Dr. Corenman, we're going to keep you around because we're going to find out how we can make sure we're lifting properly, and then if things do go awry, how you can help us out.
Very good.
So we can find out more, neckandback.com, and he is available at the Stedman Clinic, 479-5895. Stay tuned. We'll have more on the back.